Our next career opportunity will make you a part of the frontline surgical team and lets you assist in high stakes situations that require clarity, confidence, and quick thinking. The team from the University of Kansas Health System joins us with a look at the important role you could play on the surgical team.
Hello, I'm Alan Van Zant at the University of Kansas Health System. I host a news and information program we show internally to our employees 3 times a week here. It's called Take 10. We explore topics, talk with people who make our health system run, and cover the latest happenings across our campuses. Today, just an example of sorts of what we do here, as we're here to interview 2 of our caregivers featured on this virtual career day hosted by the Kansas Health Association. So joining us today, Angela Zuberi. You are a surgical technologist, correct?
I am, correct.
Thanks for being here today. Also, Jeremy Thompson. Yeah, you are a sterile processor.
That is correct, yes.
I will start with you. What does a sterile processor do?
So sterile processing, just a very generalization of it, is we reprocess the surgical instrumentation that is used in procedures on the various patients throughout our health system.
And so in reprocessing, these are after they have been used in an OR.
That is correct.
You do all the cleaning and the sterilizing and everything to make sure that they are safe to be used once again.
That is correct, yes. So they will come down to us very gunked up with various forms of blood and tissue, all that fun stuff is on there, and then afterwards we get it all cleaned off, send it through our gigantic washers that we have so that we can send over to our assembly side where we will reassemble those sets and get them ready for sterilization. So
that blood and gunk you are talking about is why I'm in a studio instead of out there with you all. Angela, a surgical technologist. Tell me about your job.
Well, once those instruments come up, we are actually getting ready to prepare for surgery. We're setting up the sterile field, and then once the patient rolls on in, we're working hands on hands with the surgeon, giving them what they need, just being there.
Scalpel?
Scalpel.
That just like that. All right, we're good to go. Don't trust me with a scalpel. Trust me.
Watch out for those sharp
I'd end up probably hurting myself as much as anyone else. So what kind of training did you need to get into sterile processing?
So sterile processing, as it's developed and grown more and become more complex, I actually ended up taking a course for it. I know here at the University of Kansas Health System, we do offer an internship to help learn the sterile processing field. So in regards to that, I actually took a course and ended up getting certified through HSPA, where I currently hold all 4 of their certifications as of right now.
Angela, what kind of training did you have?
I actually went through Penn Valley to get my surgical tech degree, and it was like a hop, skip, and a jump, honestly. Just did some clinicals here, honestly, and it was great, and I just love the experience. So just...
Well, both of you are in fields where we need good, qualified employees of the future, and so certainly both of you can speak to your professions as well. What are challenges that you face?
Some challenges I feel with sterile processing is just having enough adequate equipment to get to the surgeons and to the scrub techs. There are just times where, we're trying to get the instrumentation turned over as quickly as possible, but also as safely as possible. We don't want to have a situation where we're putting patients at risk. So I think our biggest hurdle, at least for me, is just making sure that I have enough equipment for our scrub techs to make sure they can do what they need to do for our surgeons.
So you are in there in the operating room when a procedure is going on. What kind of stress and challenges do you face? My goodness.
Yes, anything can honestly happen at any given moment, so you have to be on high alert. Just kind of your ear, you have to have a good listening ear, paying attention to your surroundings and what's going on, at the field, anesthesia too, just all the things.
Well, we talked about the challenges, but you both love your jobs. I already feel it so much from both of you. Why? What is it about your job that you enjoy so much?
I love that every day is not the same. I love that I'll come into work and I might be doing the same basic things, but at the end of the day, it's always something new. It's always something different. I'm not working on the same instrument sets I worked on the day before. I'm not always going to be on assembly. Sometimes I'm overworking with that gunk over in our Deacon Tam side where we get all of that lovely instrumentation from the OR. Some days I'm working on the sterilizer and I'm actually sterilizing this equipment and getting it prepared to be sent up for storage. So it's the variety that I get each day, and it helps me, keep myself going each time that I get into it, and learning the new situations and the instruments like every day. I just love finding everything
You
else
both
about
have
it.
to have a lot of personal satisfaction in what you do, in the care we provide our patients, and the safety and the high quality. And maybe I stole your thunder a little bit, but what else do
No,
what else do you
so
like?
fine. Steal away. Just kidding. I actually love working as a team, working with the surgeons, working with my nurse. Just we come together as a team. That's my favorite thing. Teamwork makes the dream work.
Well, it certainly does. We hear about these great jobs you have. Are students out there listening? Maybe they want to enter your field. What kind of advice would you have for them about someone that wants to get into sterile processing?
I would say just take your time to know your instruments and give yourself enough grace to be able to say, okay, I don't know it now, but I will know it.
Well, what about you?
If you don't mind being on your feet all day, it's a great thing. Stressful situations, like I said, anything can happen at any given moment. So you have to be on high alert all the time. But it's a great field to be in. Honestly, you see surgeries, you're in there, you're taking care of the patient one-on-one, you're behind the scenes.
Well, you both have been fantastic to talk to, as I have learned a lot more about what you each do. Angela Zubiri, you made me test your name one more time. Did I hit it?
You got it.
I did it. Jeremy Thompson, sterile processing surgical technician, thank you so much for us learning more about what you do. Also, thank you as well for joining us, to you students joining the Kansas Hospital Association's Virtual Career Day. Best of luck to you all.
I want to welcome our panel of surgery support experts to answer questions about the healthcare opportunities on a surgical team. Could you please introduce yourself and tell us what you do at the hospital?
Oh, hello. My name is Angela, and I'm a surgical tech at the University of Kansas Health System.
Hello, and my name is Jeremy, and I am a sterile processing technician at the University of Kansas Hospital.
So Jeremy, we'll start with you. Tell us about the path that you took to arrive at being a sterile processor today.
So I actually didn't even know what sterile processing was when I initially started investigating this field. I was a nursing assistant for almost a decade, worked in both small assisted living facilities as well as in the hospital setting. And this opportunity came around for me to join a program, and I had to apply for it, and I investigated on my own and discovered what sterile processing was involved. And that was pretty much my journey here, because all along, all I knew about was nursing and doctors and respiratory therapists, but I never knew about sterile processing. So that was my journey to this position.
What about you, Angela?
Well, I actually first started out as wanting to be a nurse, like in nursing school, and then personal reasons, like life happens. I actually have a family member who is a surgical tech, and she was telling me all about her job. And so I kind of like dug deep and like asked her all the questions, and then I looked into the program to where I was able to just get into, just Penn Valley and get my education through them.
Well, and I think both of your paths really are great examples of how a student can start out thinking that they are going to be going down this path, but then realize that there are all these other career opportunities in healthcare, and they can really explore those other opportunities because they already have a basic understanding of what it means to work in the healthcare industry.
Mm-hmm. I agree.
Agree completely.
Jaron, you have some questions from the students?
Yeah, we do. We've gotten actually several here, especially as even you just started talking. So we might have some more. If you do have other questions, keep those coming in, everybody. So first off, we'll just clarify, and this one is probably just an easy one. We have a couple people asking, so is this a 2-year degree? Is it a 4-year degree? Or is it something completely different than that? You might just clarify those for both.
For surgical tech?
Yeah, we'll start there. Sure.
You know,
Yeah.
for me or Jeremy, I'm so sorry.
You're
No, it is a 12-month program. So, and it's like, 3 semesters long all year round. Pretty straightforward, at least through Penn Valley, it was. I know there's like Washburn University that a couple other people go through their program, but Penn Valley, it's 12 months.
Then for sterile processing, there's various different programs around the country that offer it. I do know that at KU, we offer a 20-week internship for sterile processing. So it's around 20 weeks in length, and it gets you all the necessary information and your hands-on hours, your clinical hours for certification through the HSPA, which is the Healthcare Sterile Processing Association.
Okay, that's great. And so, tying with that process, Burlington High School asks, what is or how long was the residency for a surgical tech? But maybe that's more so clinicals is what it might be referred to as. So what does that look like for both the sterile processing tech and surgical techs for that kind of on-the-job training or clinicals as part of your education? What does that look like?
Sure. For me, it's no residency. It is clinicals, and you'll do your first like 2 semesters in class, and then your last semester of the program, you are in clinical. And I actually did my clinical at the University of Kansas Health System, so I was able to like go to like the Bell OR, Cambridge OR, their Indian Creek campus, like all of their locations, and kind of like experience different types of surgeries they have. And plus you need an X amount of surgeries seen from different specialties, so that was nice too, to kind of get a variety and wide range of what surgeries you like, what surgeries you don't like, and all the things.
And for sterile processing, you need to have 400 clinical hours to sit for the HSPA certification. And how the program runs here is we have a mixture of in-class learning for part of the week, and then the remaining of the week you're in clinicals. So you're able to utilize what you're learning in class at the same time as you are actually doing it with your hands on.
And Kaylin asked, so that sounds like that might be a lot of training, at least in that period, that 400 hours, Jeremy, you mentioned. So even in your day-to-day lives, so Kaylin specifically asks, what is your work-life balance like? Do you have time that you're able to make that work? Do you work long shifts? What does that look like on that your day-to-day life?
My day. Oh, just
no,
kidding.
Go ahead. Sorry.
No. Jeremy, go.
I was just going to say, when I'm talking about the hands-on with both the class and the clinical side of things, when you're at KU, it's pretty much 8-hour days as you're doing it. So you'll come in and you'll do a normal 8-hour shift, and then you're able to go home and, spend time with your family and schedule things outside of that as you need to. So there's definitely a work-life balance there. So you're not like feeling like, oh God, I have so much going on, I can't deal with all of this. We make sure that you do still have that, because we want to make sure that you have that available to you.
And then, yes, I want to add on to that. Like my work schedule, mine are 12s, but I'm still able to have like a life outside the OR, and you do take call. So it's like to be expect. I'm sure a lot of, in the medical field, you do have to take call some days, and you just have to work around your schedule. But at least for us, like we have like days, and we know what days we land, like those call days land on, to where we can kind of prepare for it if something were to happen.
Great. And so we have another question that came in the chat. And it kind of touches on, really you both mentioned as part of your pathways, Jeremy, you said you were CNA, Angela, you were maybe going through the nursing school and then pivoted a little bit. But so in terms of that career advancement, is this something that is a, entry level career into healthcare? Is it something where it's recommended you maybe work as some kind of a care assistant or a nurse assistant beforehand and work up until, or what does that kind of pathway look like if you're a student? Do you have to do any of that stuff before you were to enroll in a program?
Not for a surgical tech. Like I never had any like nursing, like my CNA or anything like that. It was just a matter of just getting still your prereqs done, and kind of getting into that field. But I didn't know anything, like I said, about like the OR until like I got the experience of like clinical, and like hearing about it from like my aunt and her experiences, and just kind of being like just like the person in the back in the OR, like no one really thinks of as a surgical tech. They think of like the doctor and the nurse in the OR, but they don't know like what actually goes on, like who helps set up the room, who helps, set up the procedure, and like who's like next to the surgeon, like handing them instruments. Like we are not operating. We do not operate at all, but we are there like assisting, like giving the surgeon like what they need. So actually being up in the field and like being right there and like helping the patient, especially when they first roll into the OR, they're very vulnerable. So it's just trying to like make them feel comfortable, welcome, at ease as much as possible. It's like they will not most likely remember who you are, but it's still like you're changing a person's life and making a difference too.
And with sterile processing, I would agree with what she says. Like, I have helped people, and when I even started, being a nursing assistant helped me understand some more of the um, like procedures that we were cleaning instrumentation for and understanding that side of things, but it wasn't necessary. I've known many people that have went through various programs that have started in housekeeping, that have started in the kitchen, that have started in all these other various fields into sterile processing. And then with that, you can grow into this. There's so many opportunities with sterile processing to advance into different roles, into management and leadership type things with sterile processing as well. And you make sterile processing what you want it to be, so you can grow and do what you want to do with it. It's your choice. If you want to just clean instruments all day and that's what you love to do, you can do that. But if you want to be a leader and grow those skills, you have that opportunity as well.
Those are both great answers. Wow, that's awesome on both ends there. So I've got a few more questions. So I've got a couple that I'll each ask that were specifically pinpointed to each of you respectively. So first, Jeremy, Peter asks you, did COVID impact your job in keeping supplies sterile? And maybe how did COVID maybe affect some of your work?
So with COVID, it never stopped surgeries. As much as, you would hear like, surgeries like, or the hospitals were like shut down in various situations. Surgeries were always open. We just limited the election surgeries that could potentially wait for the safety of those patients that were coming in. Because when you are in the surgical area, you are vulnerable, as Angela said, and we didn't want to risk your exposure to it. So we slowed, but we never shut down. So we were able to still get our instrumentation sterile, and able to still get the stuff in that we needed, especially when there was some supply chain issues, but we were still able to get what we needed to get done. It just kind of slowed it, and we had to pivot and utilize our other entities that we have here at KU to pivot around our needs so that everybody got what they needed.
And then, so Angela, a question that Kim asked for you: how do you handle unexpected situations or complications during a surgery, since you are somebody that is in the OR during those situations?
Yeah, there can be stressful moments in the OR, and like the best way is to honestly just stay calm, and you have to like you just have to stay calm and like be attentive. You have to have your like listening ears on, pay attention to like the surgeon and what they're doing and what they're saying, and then also communication, like everyone's communicating with one another, but staying calm and being high alert, like listening to like those cues of like, oh no, like what's this, or like the monitors on the screen. Like there's like big indicators to where like if something is going south, like you need to like just tune in.
And I do have one other question that we had came in a couple different times. The first time I'll mention Hodgman County High School asked this about what is maybe a range of either salary or hourly pay, or maybe let's at the entry level range, and is there room for that growth in terms of somebody wanting to maybe do this for their career? What could they kind of expect
For their salary?
Yeah.
Okay. Yeah. It's definitely, it progresses like, throughout the years. I believe it probably like salary ranges probably start around like 42,000 to like maybe ranges up to like in the 50,000s range. So, I mean, it's pretty, livable and comfortable. So I'm very happy with like that salary range. Does that answer the question? I'm so sorry.
Yeah, absolutely. And Jeremy, do you have anything to add, or is that similar to your side of it?
So from my experience when it comes to sterile processing, when I started, and doing like an internship type role, I was being paid about $16 an hour. And then as I progressed with more experience and was able to transition into a more full-time role outside of that, it ended up jumping up to about $20 an hour. So just from, initially learning to just going into a full-time role, you could see that change there. And then once again, the more you do, the more you learn and grow with it, your pay will go up with that as well, especially with that years of experience.
Yes.
All right, that was our last student question. Shireen, we'll pass it back over to you.
Thank you, Jaron. So this is a question for both of you. Can you share a particularly challenging or interesting case you have worked on as in your professions?
Challenging. I'll just say like last week, like I don't do a whole lot of vascular and instrumentation. Since he does instruments, it was just like the vascular clamps. Oh my goodness, they are so different. Everyone has like their basic set of instruments that it doesn't matter what specialty I feel like you do, everyone knows like at least their basic set of instruments. But those vascular clamps, man, are wild. So I think just working with the surgeon didn't have their resident, and then like I said, I never do this, so that's also like a challenge. You will get thrown into sometimes cases that you are not like familiar with, but you have to like overcome, like calm yourself down and like kind of jump over that hill and just kind of like do it. But he was very nice. I'll say that. Like he was very patient, very nice, despite not me. I've been a scrub tech for it'll be 5 years in June, but like I think the challenge of that is just like you think you know everything. Like you think you know everything, but there's always like room for like learning and improvement. And there's never a dull moment. And if you get thrown into like something that you're not used to doing, you just have to kind of like, what's that saying? Like grab the bull by its horns or something. I don't know. And just because you're there for the patient and you just have to work through it and kind of just trot a lot.
Jeremy, do you have a particularly challenging or interesting case that you can share with us?
I wouldn't say challenging or interesting with the cases when it comes to sterile processing. I would say it's just every day is new when you come in and learning your instruments and knowing them. Because as she said, when it comes to vascular clamps, they are very different for very specific reasons. And it's one of those, give yourself enough grace to learn those, and you will eventually. And then, being able to help where you can and know the hot spots to clean on them. So.
Well, thank you both for joining us today and sharing your insight into a career in surgical support. Have a great morning.
Thank you.